I have to trust my doctor and they have to trust me that I'm telling them the truth and that they're going to listen to me and that they know when I tell them something, I'm going to be heard. So that's what's most important to me is not just that I've seen them a few times. It's that trusting relationship. They know me, I know them, and there's that bond. And they've actually reviewed my medical records. They know my history, and they know things that I've been through. My name is Susan. I live in Dalles, Oregon. It's about an hour and 20 minutes away from Portland. I had a primary care doctor I'd been seeing for 28 years, very trusting relationship. She knew me, she knew about my surgeries. She knew if I said I was in pain, I really meant it. So she knew my not just me, but my kids. She knew situations. And so we really got to know each other and had that relationship where she could tell just by looking at me, oh, okay, so what's going on? I can tell there's something really wrong. And that is gold. I mean, if you don't have that, it's really difficult to try and inform that right away to a new doctor. One instance where that bond made a difference was for my second cervical spine surgery. I had a replacement done on a disc, and then the one below it went bad. I was terrified because I didn't want them to go back into my neck. And so I made an appointment and I said, I'm terrified. And she goes, I can tell that you're really, really scared. I'm going to give you some anti-anxiety meds just for a little bit. So I know that I know that you won't abuse them, but just to get you through this. And she said, you trust your surgeon. He did a good job for you the first time. Really have to talk to him and make sure that he understands that you're scared and maybe he can talk you through that. And that was such good advice because I did call him and he did put my mind at rest. He told me exactly what was going to happen. And anti-anxiety meds helped, but I found I didn't need them after I really talked to him. So she knew me well enough to know that I needed to do that. And you just don't get that with somebody that you don't know very well. A specialist knows about neck surgery. They know about heart. They know about specific illnesses or specific things that are wrong. The primary care doctor is the one that has all of the information. So they'll get all of the information from all the specialists, and then they have a full picture of my whole health, not just if I have a tonsillitis or something. They'll know about everything. And the specialists are absolutely needed. I love my surgeon, but my PCP is the one who knows the whole person. She was a nurse practitioner and we just really hit it off. I really liked her and I saw her for 28 years. So that was a long relationship, one that I truly miss. It was very difficult when she retired because I had gotten COVID in July of 2020. She retired 3 months after that. And then I ended up getting long COVID with the migraines being the big symptom. I didn't know the new doctor. She didn't know me. And I said, I'm having migraines. I had COVID. And it wasn't that she didn't believe me. It was that she just didn't know me and didn't know quite what to say to put my mind at rest. What course of treatment do you want? She just gave me something that she thought was what I should do, but she didn't ask me that. And that is something that my old nurse practitioner would have definitely said to me. But see, she didn't know me, so she didn't know that I liked to kind of steer. I like to have some options, and then I like to steer what options I want to take. So that was the most difficult piece. And then after we started kind of getting to know each other, she went on a maternity leave. And that's when the migraines got really intense. I was having them 2 or 3 days a week. I was not having a quality of life at all. So then I had to see another new person. He was fine and he tried to help, but they ended up finally sending me to the pain clinic. And I had to try a bunch of different medications that I had side effects on that were horrible. So the whole thing just wasn't, I didn't have that trusting relationship.